Hi there. My name is Gayatri Devi, and I'm founder and director of Park Avenue Neurology in New York City. I've been working in the area of memory disorders, cognitive disorders, and dementia since 1994. And I wanted to discuss with you today some of the challenges that my patients who have dementia are facing in the time of this COVID pandemic. I have a patient in Brooklyn who's 90 years old and is the patriarch of a very large family. He has children, grandchildren, great-grandchildren, and they all visited him in this very lively household. And immediately upon the shutdown in mid-March, all this noise and activity and visits stopped suddenly. His wife, who lives at home with him, for fear of infecting him or getting him sick, started to wear a mask herself. People asked him to wear a mask, and he refused because he was confused about the need for wearing a mask, and he didn't quite understand the overall problems with the pandemic. His family called me about a week after this isolation started to say that my patient was very confused, very agitated, and was having trouble sleeping at night, and during the day was spending a lot of his time being fretful, screaming, saying he wanted to go home. In other words, he looked and sounded scared. I decided on talking with the family that rather than putting him on medication, we would see how to get him back into an environment that he found familiar without putting him at risk. First, we asked that his wife remove her mask because she lives at home with him. Second, I told his wife that he doesn't need to wear a mask because A, he refused to wear one, and B, whenever he put one on, he would get very agitated. Third, we chose 3 children and 3 grandchildren who could visit him outdoors in their garden, and with social distancing, did not need to wear a mask so that he could see them and be able to talk to them and be in a setting that he found mostly familiar, although still a little different from his old existence. And with these small changes, he was able to be calm, to be able to sleep at night, to be able to be not anxious or fearful during the day, and we didn't have to put him on medication. This is the problem with the pandemic in terms of the prophylactic measures that are required for all of us, but that particularly impact dementia patients, which is that we should all wear masks and that we should maintain a social distance and avoid touching others. Now, when you wear a mask, it's harder to hear, and certainly you can't lip read anymore. Older patients often use visual cues in order to understand what someone's telling them. And they also, especially when they have dementia, look to your face to see if you're looking happy, if you look like you're going to be a threat or not. They also have trouble hearing. So when you wear a mask, it makes it much harder for them to understand. And they also tap into fears that they may have, which may make them agitated. So I really don't like using the term agitated in this situation because it's really a fear arising from a particular issue that allows us then to address the issue, whereas if we just use the general term agitation, you really can't address the issue. So in this situation where they are socially isolated, where people can only speak to them through a partition, or they're deprived of human touch, which is so important for all of us, then they become anxious, in which case we can then address the issues. How can we reduce the social isolation? We can do that by, as I said, social distancing in a safe environment without using masks. Or if you do need to wear a mask because you have to attend to the patient, then you wear a good N95 mask, which will protect the patient from risks from you transmitting the virus to them. And you wear gloves, you get up close to them and take care of what you need to, And at the same time, you also at some point give them a human touch, a hand on the shoulder, something that helps them understand that this is not a threatening stranger with a mask on who's coming over to harm them, but someone who's there to help them, which is difficult to do, but patients do understand. I think the value of the eyes in terms of human contact is particularly important in this regard. I'm going to end with a happy story. One of the things that I find in dementia care is that patients often lose confidence in themselves. They feel that they're not able to do things, and as a result, they do less and less, and family will help with it. I have a patient who is in her 70s with Alzheimer's dementia, who had just such a family, helpful in every way. But when the pandemic happened, they could no longer visit her, and so therefore she had to do everything on her own, including shopping, including wearing a mask, making sure she was taking her medication. And all of a sudden, she's done a great job. She told me she lost 15 pounds. She's been taking her medications much more regularly. And most importantly, she's developed confidence in herself. So the pandemic in most patients with dementia can be problematic. And in some people with dementia can actually help them regain some sense of confidence in themselves. I hope this has been helpful to you. And if you have any questions, please post them and I will try to answer them.